Dr. Sonya Wilson serves as the Chief Medical Information Officer for Physician Services at HCA Healthcare, where she leads initiatives at the intersection of clinical care and healthcare technology. With a strong background in primary care and urgent care medicine, she focuses on optimizing care delivery through data-driven solutions and operational innovation. Dr. Wilson is committed to improving patient outcomes by enhancing efficiency, access, and quality across HCA's urgent care services. Welcome to DX the Podcast, Sonya.
Thank you. I'm so happy to be here.
Same. I feel like it's a long time coming. We're friends at this point.
Yes.
I've loved just getting to know you over the last couple of years, and it's super exciting to have you here on DX.
So. It's always great to speak with you.
Yes. Well, we're going to jump right in.
Absolutely.
Honestly, there's just so many reasons that you shine, but I want to find, what I find especially compelling is your journey from clinical care to informatics. So I want to find out a little bit more about that. So tell me where that passion sparked and how your career pivot or role change really manifested.
Yeah. So such a fun story and question. If you asked me this when I was first in the informatics roles, I would have told you, I don't know, I just asked a bunch of questions and I wound up here.
Yes.
But when I take a look back, I mean, I've always wanted to be a physician. I'm pretty sure my first words were, I'm going to be a doctor out of my mouth is what my parents joke and I talk about. And so I had lots of healthcare summer jobs, different careers along during my education pathway. And a lot of them focused around technology in healthcare. So one of my very first jobs was moving data from one EMR to another. And then I got in return to walk the halls with some famous surgeons and get to learn from them and experience and be in the OR, which was awesome. There's other jobs I had along through there. So when I fell into residency, I helped make the residency workflows as there were different pilots and different situations. And then I did residency in the day of paper charting with some EMR aspects. It was a little hybrid situation.
Same.
And so I was a part of the committee to bring us into the full-blown EMR role. So I worked for over 2 years on navigating what that looked like, and then got to be a part of supporting turning on the whole hospital systems and the clinics on it, and make sure that my attendings didn't throw their computer out the window or through the wall or somewhere, or do, so that was sort of how that happened. And then when I came out of residency and I was working in ERs and urgent cares, I did the same thing and started helping to form that. And a few years later, I came a pivotal moment of, do I continue down the path that was sort of set in front of me of becoming a medical director, going towards potentially being a CMO, or do I go in a different direction? And I really took a step back, took a pause to think about, what do I want? What brings me joy? And I had this vision of really helping other physicians, other providers, patients in the clinic just really have a frictionless experience with the technology that we're using, so that we can just have a conversation like we are here and be really engaged in the room to care for our patients, especially when it's so important in that urgent care space and where you have to capture and become friends.
Such a short amount of time.
So
let's make this happen.
And I don't want to worry about the computer. And I just really wanted that to be an afterthought instead of a frustration. And so that has been where I pivoted into that.
That's awesome. And just to think about the ripple effect of like the decisions made and kind of the efficiencies established and how that ripples throughout the entire organization.
Oh, exactly. And how I get to help many patients through the many providers.
Oh, yeah, absolutely. All right. Well, as we know, kind of at this moment in time in technology, turning AI into better patient outcomes demands more than just technological progress. So let's talk about some other types of meaningful progress that we must make with our teams and our patients to make sure that these AI technologies will stick or be trusted. Maybe give a few examples of kind of what's working and what's not working right now.
Yeah. So that's great. Well, first of all, I feel like we're still in the infancy of how we're using AI and what will it look like. And it's such an exciting time to be able to do that. One thing that obviously is working really well is really telling the story and connecting of how it can be impactful. Because getting that change curve with it, you really have to show them what it's going to be like to use it.
End result.
So that's what's,
Yeah, for sure. I mean, because you think about it, anything new is still new, regardless of what the ease of use is expected to be. It's still a new process, a change, et cetera. So kind of getting that buy-in is very important to recognize what is the end result going to be. So, talking about introducing these new processes and any new technologies, we're all embedded in these systems that are traditionally somewhat slow to change. This is healthcare. So how do we build this real buy-in? Kind of what strategies do you have that are effective in overcoming this really kind of slow to change process, and communicating things like urgency and potential of these types of technological breakthroughs, kind of trying to resonate with the stakeholders?
Yeah. So again, with everything still being in the infancy, it's this big balance where you have to hold on to. When you're using it now, you get to learn and evolve, give the feedback, and be at the forefront of tomorrow now, because we really are that vision that I had. We're almost there.
Right. Just that conversational opportunity. Just be able to have that natural conversation and let the documentation happen. Take away the clicks from the providers. Oh my goodness.
No more click counts in our future. One day we will not be judged by click counts. And just really talking to them that while it is new, it is thinking outside the box compared to how we've thought before, and showing them simple ways and talking about how you can use it, think about it different, and then reminding them, just like when we convert to a new EMR, sometimes you have to slow down and not be the expert. It's hard because we're used to being the experts in the room. But if we take those little bit of time away from our day to slow down and learn and play with it, it actually accelerates us to that higher efficiency because we took that time to slow down instead of just staying the same pace.
So it's slow down to actually be quicker.
Exactly.
Yeah. It's an oxymoron, but very relevant to new technology. All right. Well, I can't close out the conversation without recognizing that you and I both are women leading in technology arenas. And as Forbes has noted, women make up only about a quarter of the entire tech force, and the gap becomes even wider at the executive level. So only 11% of tech exec roles are held by women. So from your vantage point in the C-suite, what are you observing and navigating? What mindsets or points of view have been most critical or unique to your success at this level as a woman executive?
Yeah, so I think really where my thought process comes from is the fact that I'm a woman is not what I take into account when I walk into a room. That's not my focus, is being a female leader. I am and proud of it, but that's not my focus. My focus is to come in and do my job and explore what I'm doing, and I enjoy it. And taking that out of the equation, it's not even there. A part of the equation is just who I am. Just like I have brown hair. I walked in with brown hair. I walked in female, and here we are.
I love it. So you get in there and you get the job done, and that's what matters at the end of the day. I love it. It's great. Well, it's been awesome to have you on DX. Thank you so much for joining us. Like I said, kind of a long time coming since we're good friends now.
I know.
Can't wait to talk to you again here on DX the podcast.
Yeah, I can't. Thanks for having me.